Margaret is Labour MP for Wirral West, an MP since 2015, going into politics through activism in defence of the NHS against the Health and Social Care Act in 2012. She's been a fantastic supporter for campaigners in defence of the NHS, and is, in fact, was one of the leaders of the main private members bill sponsor of the NHS reinstatement bill in 2016. She is now also a strong supporter of our End Social Care Disgrace campaign. So welcome, Margaret. Thank you for speaking.
Thank you very much, Tony. And can I just start by saying, how powerful all of the contributions have been this evening, and how important that they are. So I'm really pleased to be here with you. Of course, as other speakers have said, social care is something that either affects all of us or will affect all of us, or the vast majority of us at some point or another in our lives, whether that be us ourselves personally or family members or people that we love and care about, and people who become unpaid carers at short notice. So this is a universal need that we all have, and yet we don't have a solution for it in government policy. There's a huge volume of unmet demands. So earlier this year, it was reported that more than 500,000 people in England were waiting for an assessment for care to begin, direct payments to be made, or a review of a care plan. That figure of 500,000 was up from just under 300,000 the year before. So clearly this is a situation that is bad and is getting worse. I believe, as people on this call do, we need a national care service that puts people's needs at the heart of the process and that treats everyone with respect. But what we actually have is a care marketplace with the pursuit of profit embedded in the system. So while care workers work incredibly hard to do a really difficult and skilled job on low pay, the system in which they're working has not been constructed with the needs of residents at its heart. I want to give an example that illustrates this. So a constituent spoke to me a few months ago about how when her father was near the end of his life, he needed a care package. However, none was provided because no provider bid to meet his complex needs. So at the end of his life, his needs were posted on an online portal for providers to bid for. It's just a shocking scenario, isn't it? And none came forward. So instead of there being a care service to meet the patients' needs of how complex they are, there's a system whereby providers bid for patients who they wish to care for. So we need a care service that puts patients at the heart of things, rather than one that's built around the business models of providers. And as Prem was speaking previously, so many homes are owned by private equity firms, and there are real concerns about those that fail to provide acceptable levels of care to residents, where clearly, if profit is your primary objective, it's almost inevitable that that will be the case. So, as has been mentioned, we've got a staffing crisis in the sector. It was reported a few months ago that because of this crisis, there have been vulnerable people in care homes being left alone in rooms for 24 hours and denied showers for a week. Issues with recruitment and retention of staff in social care sector have been widely publicised. So there's around 165,000 vacancies currently in social care in England. It's extremely concerning, especially when estimates suggest that England will need close to 500,000 more care staff by the middle of the next decade. It was reported recently that the average hourly pay in the independent care homes in England in 2020 to 21 was £9.1p. That was the latest period for those figures to be available. So those compare with those of people working in coffee shops getting over £10 an hour, and in warehouses earning between £10 and £12 an hour, and some supermarkets paying more than this. The Social Care Select Committee in Parliament has acknowledged that pay is a crucial factor in recruitment and retention in social care, and social care providers are consistently being outbid by the retail and hospitality sectors. That's so shameful, isn't it, that this is acknowledged in Parliament and yet we're not seeing action on it. That Select Committee report also warned in relation to retention of staff that whilst pay increases are sorely needed, merely raising wages is not enough. A long-term sustainable strategy is needed, which includes the prospect of pay progression, professional development, training and career pathways. On the issue of recruitment, it noted that wider market forces, including the rising cost of living, a lack of affordable housing and a lack of public transport in remote locations, are having an impact on the recruitment and retention of health and social care workers. And I think we can all recognise that. And it is this lack of provision of care, but also for the the working conditions of people in the sector. So the government's recent autumn statement, the Chancellor announced, he said, up to 2.8 billion in 2023-24 in England and 4.7 billion in 2024-25 to help support adult social care and discharge. But there was no detail about how much of that money will be used to tackle staff shortages and improve retention. Now, at the Labour Party conference earlier this year, the Shadow Health and Social Care Secretary, Wes Streeting, said that under a Labour government, care workers will be guaranteed fair pay, full rights to work and proper training. This is welcome, and it's the very least that the government themselves should be guaranteed. The money that the government announced for social care in the autumn statement includes money specifically for what they called getting people out of hospital on time and into social care. Now, the issue of hospital discharge, I believe, is fraught with difficulty. Of course, we all want to see people discharged when they're ready to be discharged, but those who need social care need to be able to access it straight away, and they need to know that it's the right care for them. So while nobody wants to see people in hospital longer than they want to be, if patients are discharged too simply because of a desire to free up beds, which, there's a big narrative around this, isn't there? Their conditions can worsen and they can come back into hospital again soon after. And you can also have situations where family members are being asked to look after people who they don't know how to look after because they're not equipped to care for them. This is something I've spoken about in Parliament on a number of occasions in the Government's Health and Care Act 2022, or bill as it was, which enables local areas in England to adopt a discharge model known as discharge to assess. So under this approach, hospitals are able to discharge patients before their social care needs assessments have been carried out, instead of after. The explanatory notes that accompanied the bill stated that requirement to carry out assessments before discharge has resulted in some individuals experience delayed hospital discharge as they wait for their assessment to be carried out, meaning the appropriate transfer of care cannot take place when a patient is ready to leave hospital. Of course, it's missing the very obvious situation with there's insufficient care available. So delays are very often due to shortages in the social care workforce and the lack of available support for people, either in care homes or in their own homes. In the passage of the bill, the Royal College of Nursing warned about discharge to assess that, they said, without assurance around registered nurse staffing levels, including in social care and or community settings, this cannot be implemented safely given the current state of the system. So I believe that we need to solve the issues around workforce and staffing crisis before something like discharge to assess can be implemented safely. Unfortunately, it's on the statute and it's happening now. I'm concerned about it having serious implications for the health and well-being of patients and for the many millions of unpaid carers who may be left to pick up the pieces and take over the care of their loved one once they've been discharged from hospital, regardless of any continuing health and care needs that the person who's been discharged may have. Discharge to assess has been taking place throughout the pandemic under temporary provisions of the Coronavirus Act. There had also been some pilot schemes in various parts of England since 2016. However, now this is put on statutory footing. In May of last year, I asked the government how many of the 4 million patients discharged under discharge to assess since the Coronavirus Act of 2020 had been readmitted to hospital in 30 days, and the government said that they didn't hold the data centrally. In other words, they don't know, nor do they have any interest in understanding clinical outcomes of this policy, despite the fact it is likely to affect millions of vulnerable people. I believe it's vital that the data is collected and made public, given the implications for patients and unpaid carers, and so the effectiveness of the policy can be assessed. An independent evaluation of discharge to assess from April of this year notes that what has been achieved by the discharge to assess approach throughout the country is a mixed picture, and then they don't expand on it. But this does suggest that they have nonetheless hinted at problems with the approach. And so we need more work to be done on this to ensure the safety of the policy that's being pursued. Turning to just the Labour Party position, I was very proud to stand on a manifesto in 2019 that pledged to build a comprehensive national care service for England and provide free personal care. That manifesto pledged to provide community-based, person-centred support and underpinned by the principles of ethical care and independent living. So this national care service has long been an ambition for Labour. I'm conscious of the time, so Tony, do you want me to maybe speed up a bit?
If you've got a couple more minutes, will be fine.
Okay, smashing. Okay. So one of the final acts of the last Labour government was to publish a white paper on building a national care service. But of course, we lost the general election in 2010, and that paved the way for the Tories and Lib Dems to set about their own reforms and bring in the Health and Social Care Act 2012, which was, of course, a big privatising piece of legislation. Over the summer, we're streeting Shadow Secretary State Work and Pensions, and that's Labour will aim to bring in a national care service in England with just as much ambition as the 1945 government brought in the NHS. He reiterated that at Labour Party conference. Fabian Society is looking at how such a service will be funded and structured with a view to bringing it in over the course of several parliaments, and I recognise the comments that were made earlier. I think it was by Rachel about this, which she said, we need care now. So it is a long-term ambition, but I do believe this is going in the right direction. One of the things I would say is that people have made so many really valuable contributions. The Labour Party has a national policy forum. It's currently closed, but I understand it will open again next year, where anyone can put down policy ideas and things that they think are a priority. And I would urge everybody in this campaign to get involved in doing that when that reopens. We have a real sense of urgency that we need to make the case for a national care service. And I think some of what Prem was saying around some of the difficulties was absolutely spot on in terms of saying that it's up to us to make the case and make the demands. And I would urge people to contact their members of Parliament, ask for a meeting with them or ask to speak to them on the phone and put forward why it is that we believe that we need a national care service that is free to all who need it, paid for through direct taxation, and one that treats people with dignity and respect, and enables them to take their place in whichever community they choose to live in. Thank you.
Thank you very much, Margaret. Thanks for speaking and for your offers for ongoing support.